Hi all! This is Alice from Stride Strong Physical Therapy, and today I'm going to go over the top 10 questions that my patients with knee pain have when they come into PT. But first, I want to go over a little bit of knee anatomy.
This is a cross-section of the knee. So if I was looking straight at a knee, this diagram shows what is underneath all that skin and hair. The red bits are muscle, and that circle in the middle of the knee is your kneecap, also known as the patella. The kneecap is a floating joint, meaning it is tethered in place by fibrous retinaculum and tendons, namely the quad tendon and patella tendon. See all that white in there? That's what's holding your kneecap in place. If one of these tendons is pulling too much in one direction or another, you can imagine that kneecap will now be yanked and dragged into that direction even more. Now, this is important because a great deal of what I see with my patients in the clinic is kneecap pain, where bad body mechanics pulls the kneecap out of its ideal alignment and then causes gradual arthritis. I also have to point out the crucial parts of the knee: the ACL, MCL, and the meniscus. There are a few more ligaments involved in the knee, but these three seem to get the most damage in contact sports. Injuries to these tend to be really sudden and acute, meaning tears and damage usually come from a forceful pivot, fall, or tackle. Damage to these structures will cause more than pain. Instability tears can vary widely in severity, from minor to huge complete tears. The complete tears will likely warrant orthopedic surgery.
Even if there is a lot of damage that could happen in the knee that warrants orthopedic surgery or injections, there still are a lot of knee conditions out there that us physical therapists can absolutely help. Now, you might ask, well, if I have damage in the knee, then shouldn't someone try to fix it? Well, technically, no, because sometimes the fix is irreversible. So it's always better to do conservative therapy first because A, it's cheaper, and B, it's a lot less dangerous. All right, first question. Knee pain is caused by pressures and wear and tear in the knee joint structure. This comes about from biomechanical faults. If your knee isn't positioned well, the angles of forces placed on it in everyday movements like squatting, stairs, running, and walking could cause cartilage to rub on each other, causing inflammation in the joint. Well, some of you might ask, how do I know if I'm not positioning my knee well? How do I get myself into a biomechanically sound position while I'm moving? The answer is physical therapy. We're experts in watching people move, and we know how to correct these movement faults. These exercises we recommend, there's always a reason for each of them. In one word, no. Rest is not effective for knee pain. Rather, activity modification is. Just simply being a couch potato is not going to help your muscular structure, nor is it going to help your biomechanics. Rather, if you have knee pain during doing certain things, adjust your frequency of doing those activities while your knee calms down and while you seek help from PT. If you do an activity, let's say aerobics class, and you experience knee pain, and each time you repeat the exercise class, the pain not only comes back but keeps getting exponentially worse each time, then you might need to see an orthopedic doctor. Here's another helpful tip. If your pain starts spilling over into other activities, such as aerobics class irritation now spills over to your ability to walk to the grocery store, then it's time to see an orthopedist. If this doesn't describe you and you still have knee pain, you need to see a physical therapist. No, a total knee replacement is a really big deal. The surgery is extensive and the rehab after the surgery could take half a year. There's extensive scar tissue and the surgery and rehab will need you to take extensive time from work. I have helped a lot of my patients who thought they were headed for total knee replacement and avoid it altogether from strengthening their muscles and correcting their biomechanics, such that their pain is no longer severe enough to warrant intervention. There is still no concrete evidence out there that running causes knee damage, but I can definitely tell you that the factors that highly correlate to knee damage are bad biomechanics in moving, and that includes bad biomechanics during running, sedentary lifestyle, and obesity, all play a huge role in the health of your joints. If you have a recent bout of knee swelling, do this. Grab a frozen bag of vegetables or a cold pack and place it in a pillowcase. The pillowcase is there to protect your skin from freezer burn. And then place the cold part on the swollen or painful area and then saran wrap that around your knee for compression.
If you already have kneecap inflammation from bad body mechanics, the movement of going up the stairs will trigger your quadriceps muscle to pull on your kneecap and compress it further into the joint. Another cause for the pain could also be from patella tendinitis, previously caused by ramping up an activity like jumping or running too fast in a short amount of time. If you have pain going down the stairs, you are likely doing it with bad biomechanics as well, with the knee turning inward. Physical therapy can help you solve this with some strengthening and biomechanics guidance.
Knee braces work if you have an unstable knee. So if you have a torn ligament, then the knee brace would be able to protect you from straining that ligament. However, if it is arthritis or tendinitis, then no, the braces will not be able to stop your 150-pound body from moving in a bad direction. Now, some of my patients say that compressive sleeves help them feel better, and I believe the effects are more from placebo or compression, but those sleeves certainly don't hurt you, so if it makes you feel better, go for it. Keep using them. Just make sure you're not paying an arm and a leg for them. If you had a recent knee injury and you are experiencing knee stiffness, I have a video coming up on some easy exercises that you can do to regain some motion. You should also go see a physical therapist. They can give your knee some manual therapy on the kneecap and muscles around the knee to alleviate the tightness. If the popping comes in the absence of pain, then no, I wouldn't worry about it. If the popping is extremely frequent, however, very loud, or you feel a jolt of pain when it happens, you should see a physical therapist before you make more wear and tear on your joint. Those are my top 10 answers for your top 10 questions. And if I didn't cover a question you have on your mind, please subscribe to my channel up here and post your question down below. I only answer questions to subscribers. Looking for knee pain exercises? Click on these videos to the right of me. If you're wondering how to get in touch with a Stride Strong physical therapist, please call the number below and we'll get you connected with an appointment. We offer in-person and telehealth visits. This is Alice, signing off.